No. Yeah, yeah, but right where you
When
poked.
I was pushing though, right?
Right where you poked.
Coracoid is right there.
So for those of us just joining us, we're trying to differentiate between the long head of the biceps and the
The
short
long
head
head's
of the
out here.
biceps.
No pain out here.
No. No, there's just.
Bicipital groove's like right there.
Yeah.
No pain there. It's more here.
And
Yeah.
he's previously had a rupture of
Yeah, 5
the
years
long head
ago,
of the
I picked up a
biceps.
big round of oak and
Got
tried to put it in
the
the back of
Popeye.
the pickup, and
the Popeye.
I
yeah.
felt the pop and then the
Lift
red
this up.
hot pain.
Yeah. Does that bring on any pain?
No,
Good. So yeah.
it's just that I'm trying to
Not
sleep at night. I can
impingement.
feel this real deep
deep. Yeah.
ache.
Mm-hmm.
Yeah. Hi, Holly. Okay, so
Yeah.
so we'll go ahead and do the medial
Yeah. Yeah. And I think
medial head of the biceps, which is not the usual one that this happens to, because usually people have the whole thing intact, and usually it happens in the one that you ruptured previously.
Yeah.
So I'll go ahead and get the medicine drawn up, and we'll do it. Let me mark for the nurse the general area that we need to get.
you want to just feel it and go
Just kind of in that area.
just lateral to the coracoid.
Yeah. Just lateral to the coracoid.
Yeah. So you can usually feel the coracoid.
My daughter's had a couple of these.
Oh yay!
She said she had
Now you can
relief.
commiserate.
Huh? Yeah.
The injections
Oh,
actually.
oh, that hurt.
Yeah.
So medial, but the coracoid is where it attaches.
Right.
So it'd be about lateral.
Yeah. So did I say medial?
You said medial.
I meant
So a little bit lateral. Yeah. Yeah.
Oh,
There's
right
the
in.
coracoid. So I want to go.
Oh, I felt that.
Nope. Yeah. Okay. So we'll try to get that whole area by the nurse. We'll have them get you set while I go drop some drugs for you.
Okay.
We'll get you set up here. All right. We'll be back in a moment. So for now, we're going to go drop some medicine. Would you be able to do a prep on?
Yeah, did you draw that?
I did. Yeah, I drew a picture on it. Okay, so let me turn this. Now I can read your questions. Sorry, I've been spending all my time getting the procedure ready. So you guys are getting kind of familiar with this now if you've been watching. That we get a few different medicines. It's very nice to say, oh, Danielle, thanks for asking about my mom. She's much better. She's at home. She got all better just with the medicine they gave her, and she's fine now. Now, for those of you who just joined us, we're going to do an injection. Kind of an unusual injection. It's those who were watching earlier saw that both Dr. Dwayne Vaughn and myself were discussing what to do in this particular patient because usually when somebody has a bicipital tendonitis or a tendonitis of the biceps tendon, it's the long head of the biceps. It's called biceps because there's two heads to it, and there's two tendons that come up in the shoulder, and usually the long head is the one that gets inflamed and that we inject. But in his situation, it's the short head. He doesn't have a continuous long head anymore because he actually ruptured his tendon.
You can show them some
And you
anatomy if you want.
I'll just show it on. I'll show them the real thing.
On the real thing.
And of course, hey, somebody's gonna be a nurse. That's cool. We give thanks to Dr. Dwayne Vaughn here, who's just barely out of screen, for helping us. Yes, the disembodied head of Dwayne Vaughn. Thank you for helping us with this one. And as you can see, I am really enjoying having a partner in my practice because I would not be able to just grab another doctor to look at things I had a little question about when I had a solo practice for those 9 years. So we are loving it. So this is the cortisone-like medicine. This one's called methylprednisolone, and it works well for this sort of inflammation as an anti-inflammatory. So drawing up the medicine here. And he did give consent. Those of you who are HIPAA police out there, we do have consent. So that is ready. But in addition to that, I also draw up the anesthetic. In this case, we're using bupivacaine. Brand name is Marcaine, 0.5%. We're going to get 3 cc's of it. Oh, thank you for the hearts, by the way. How long has he had the pain? This has actually been going on for, oh, gee, well over a month. He's quite a golfer, actually. And the golfing has been aggravating it. Yeah. Oh, you're on what's it called? Periscope. If you want to say hi to everybody.
Hello.
Jessica says hi. Lisa, do you want to say hi to everybody?
Hello.
Another disembodied head. That's how Gwen did it. So a couple of the excellent medical assistants we have here at the Auburn Medical Group. Can you throw away a couple of sharps for me?
Yep.
And then all of the paper trash. Where'd my thing go there? Okay. All right, so let's go give them an injection. And those of you who have seen my injections before know that I like to give 2 shots with 1 needle to get the best, well, make it the least painful possible. Let me grab somebody to hold the phone here. Hold on a second. Is anybody free to hold the camera? All right, we'll just turn around like that and get as close as you can without being actually in the procedure.
Okay.
So we'll have you sit just like that. I'll keep my instruments here, and to make it less painful, I'm going to grab the Guy Bauer's ethyl chloride spray. People like that.
Doctor talk.
And here it is. So this is the stuff that makes the skin cold. First, we have to be careful because it can actually cause frostbite if you do too much of it.
Ooh,
Yeah, that'd be
I
good.
don't want that.
It will feel cold though. So again,
I'm confident you've done this many times.
not so many of the medial head, because most people don't have a broken long head of the bite.
Oh.
Usually we're doing it over here, where we were pushing earlier, but it didn't hurt. So this one we don't do as often.
Huh.
Yeah. So yeah, you're supposed to have the doctor who's done the procedure a lot of times. Not as much with this case, because no doctor has done this procedure, at least in primary care, a lot of times. Orthopedic surgeons did. Whoop, whoop. And you don't want to go to the doctor with butterfingers either. Okay, there we go. So I can give you all this advice of what not to do. Okay, is that cold?
Yeah.
Running down the arm there?
Yeah.
And we do it until it starts to turn whitish.
Oh.
I don't know if the people at home can see that. Actually turning colors. All right, again, I'm pushing in. I'm sorry. Yeah, this is going to hurt because I have to really get the right spot here. Here we go. And what I'm doing is hitting the tendon.
Just breathe in and out.
Actually, not the tendon, the sheath around the tendon. If I was hitting the tendon, the plunger would not go down. And if I forced it down, a little bit different here, that would not be good for the tendon to put cortisone in it. So we go just on top of it, and I'm actually feeling with my thumb where the right spot is. The thumb that's on the plunger is telling me. Because you can rupture the tendon if you put the cortisone in the tendon.
Mm.
And then finish by giving you some anesthetic, because we do not want cortisone in this tract. Okay, now move your shoulder around.
You're done?
I'm done. Are you done?
I'm so tensed up, I don't know. I'm getting a head rush. A brain freeze.
Okay, there you go. Take that, thanks. So, reach to the middle of your back like that. Could you do that before?
No, I didn't try it. You know how you nurse a pain?
No, that's right. You don't even try things.
No.
How about reaching for your hip pocket?
For my what?
Like reaching, like.
Well, yeah. See, I had to start putting my billfold over my left hand side because it was too painful to reach back for my billfold.
How is it now?
No, better.
Nice to have it numbed up, huh?
Better. It's numb. Okay. Yeah, no pain.
Okay, good. So let me.
I told my granddaughter, I says, I don't usually request this, but can you get my billfold out of my pants so we can take it?
All right. Now that you've had that numbed up,
Yeah.
that anesthetic's going to last for about 5 hours or so, and then it wears off.
Yeah, they wear off.
And then it hurts just like it did before until the cortisone kicks in the next few days. Possibly, rarely, it even takes more than a week for it to kick in. So be ready for that.
Okay,
But when it kicks in, you'll have this relief.
yeah.
Yeah. And people are talking in Spanish to me here, so I can't tell you what the comments are because I don't read Spanish well enough. Anything else you need today?
That was it. Oh, this seems to have healed up finally.
Yeah, it looks good now.
Yeah.
All right, good. Well, thanks for. Yeah, I'll let you have. Thanks for participating.
You're welcome.
That was fun. So I'll tell everybody what's going on here. So that's the procedure for an injection of the short head of the biceps. You don't see that all the time. The injection, the procedure was called injection of the tendon of the short head of the biceps. And he's going to have a good outcome from this, similar to other injections that we do. And it's really dark in my office, but this still works pretty well. So thank you for joining us. Danielle, you think it looked painful? I think so, but with that Giebauer solution, it made it, it cooled it off enough that it wasn't as painful as it would have been without that numbing effect on the skin. So that's pretty good. And then afterwards, he felt good. As you can see, he could move around. Yes, Scope Doc, thank you. And if you guys are interested in more information about our practice or for a link to Medically Speaking Radio, you can find it at askdrvaughn.com. That's a new domain that I bought over the weekend. I thought might be kind of nice for that. And I might start using that as a hashtag, AskDrVaughn, if you guys think that would work out. And also I'm considering doing some follower-only periscopes. If you people who are followers think that that'd be something that you'd enjoy, not having people drop in who don't know what's going on. And for those of you who want to make sure you get invited to that, make sure you follow by swiping right following. I got to go, got more patients, but enjoy having you guys here. See you next time.